I don't think we're hearing you if you're talking to us.
Can you hear us now?
Thank you, we could not hear you.
Technical difficulties.
Apologize.
There's Tom.
Tom, are you here to talk to this resolution? Here you go. Oh, you were there.
There.
I can.
Okay.
This resolution just extends the cybersecurity grant deadline and modifies the 2022 budget for the remaining funds. This is really done through the IT department, but because it was a grant for Board of Elections remediation to cybersecurity, it goes through us. But Rick has really been doing all of the work to bring us up to the cybersecurity regulations.
Does anyone have any questions regarding this? Okay, seeing none, all in favor?
Aye.
Any opposed? Carries. Okay, second up, I have a resolution modifying the 2022 budget for the Sheriff's Office for a 2020 law enforcement terrorism prevention program grant from the New York State Division of Homeland Security and Emergency Services, moved by Mr. Forsythe, seconded by Mr. Tanisha. Is the sheriff there?
The sheriff isn't, but the undersheriff is. Good evening, everybody. Just wanted to.
Right.
I'm sorry.
Welcome.
Oh, thank you. So this is a resolution to make a change in the budget. We had initially intended to purchase a drone under the SLTPP grant. Due to funding limitations and having to go with a certain vendor, we decided last year to purchase the drone through the drug asset forfeiture money and local monies, which we had to pivot and make a change of $11,170, and this will be used to pay for our air cards and sustainment for undercover operations and for the patrol vehicles to help our infrastructure for the IT side of things.
Does anyone have any questions? Seeing none, all in favor?
Aye.
Any opposed? Okay, it carries. Next up, we have a resolution modifying the 2021 budget for the Sheriff's Office for related overtime expenses for the Civil and Correctional Division, moved by Mr. Akers, seconded by Mr. Perkins. Go ahead.
So this resolution, obviously, it's a revolving door with overtime. We're well aware of the overtime situation, as you all are. I assure you, we're doing our best with the overages that we have. Obviously, due to COVID, things are evolving, as we all know. And the state ready's money of the $21,000 is essentially the reason for that. These inmates are in the facility a lot longer, so obviously there's state monies that come back to us to help offset these overtime costs. Obviously, with I don't have to tell anybody that the COVID and the quarantines, we've had 5 and 6 COs out at one point. Also, we've had to hold over 7 or 8 of our employees shift after shift because of watches and other issues that we have at the facility.
Does anyone have any questions about that? Seeing none, all in favor?
Aye.
Next resolution is modifying the 2022 budget for the Sheriff's Office for medical services at the Correctional Services, moved by Forsythe, seconded by Mr. Akers. We need a friendly amendment to this. The second, whereas Kenneth Hilborn needs to be changed from a PA to an FNP-C. He's a family nurse practitioner instead. Anyone move that? Mr. Akers will move that, seconded by Mr. Forsythe. Go ahead.
Obviously, we've had some stumbling blocks with some of the providers at the facility. Thankfully, Dr. Kring and Nurse Practitioner Hilborn have shown an interest in helping the county out. We've done a lot of research as far as salaries go for this type of service, and we're essentially getting a two for one in that sense. We're having two medical providers. Both work telemedicine as well as in-person visits. So we needed to transfer the $17,000 over to ensure that we have enough funding for the remaining part of the year. We go to the tune of about $54,000 for the cost of that service.
Does anyone have any questions? Seeing none, all in favor?
Aye.
Thank you. On to probation, I have a resolution modifying the 2022 budget. Approval of the bad debt write-off for the probation department, moved by Mr. Forsythe, seconded by Mr. Smithers. Tim, go ahead.
So this is debt from 6 years ago. We tried to collect it for 5 years. We weren't successful. So we sent it to Falcon Recoveries. They tried to collect it for a year. They were unsuccessful. So this is writing off the debt from, like I said, 6 years ago. I did provide a sheet that shows the last 5 years of collection. You can see our collection rate has improved every year. We're just shy of 80% now. We still try to collect this monies even after the person's off. If they end up coming back on probation, we'll try to collect the old monies also still. So this is a local law that allows us to collect this money. So unfortunately, we can't hold the client responsible for the money. So what I'm saying is, I guess we can't violate them because they're not paying. So we don't have a lot of teeth to collect it during their probation period. So this is just to kind of wipe it off our books in case we get audited down the road. It just makes things a lot cleaner.
Okay, Mr. Akers.
Well, I do this every year. Tim, can we not garnish their wages?
Again, this is a local law, so we can't. There's not much we can do. There's definitely no teeth with it, unfortunately.
Yeah, thank you.
Anyone else? Seeing none, all in favor?
Aye.
Any opposed? Mr. Akers, noted. So I have a resolution authorizing the chair to sign a contract with New Paradigm Psychological Services, PLLC, for counseling services for the probation department, moved by Mr. Fay, seconded by Mr. Forsythe. Go ahead.
So this is our sex offender treatment provider. We do have one now. She's kind of hesitated coming back in person. She'd rather do all this telemedicine. And she'd rather stay, she lives on the Governor side of the county now, and she'd rather stay there and focus more on that side. So this company comes into Messina once a week. They do parole sex offender treatment. What I like about this company is they actually accept insurance. So that will help take some of the burden off the county to pay, and obviously off the client also. If they don't have insurance coverage, our rates are pretty much still the same. In fact, the evaluations that they get, we pay $250 right now to the other provider. This provider is only going to charge us $200. So there'll be a little bit of savings there. What I like about it too is it gives clients a choice on whether they what side of the county they want to go to, so there's not as much traveling. Like I said, they take insurance. One thing I'm not a huge fan of, I want to see how it works out, but this group has open-ended classes. So the lady that does it now in our providers in the past have always had a 16-week schedule set up. It's a curriculum that they had, it's more book driven. So this being open-ended, it could go on for a year, it could go on for 2 years. Could cost us more money that way for those that are uninsured. The good thing about it also is being unlimited classes like that, somebody could start at any time. So right now, if we have somebody waiting for a group and there's a group already started, they may not be able to go until late summer, early fall of this year. Where this one, we can get them into the next class that opens up. So it'd be quicker services, I think, as far as that goes, than having to wait for a new group to start. So hopefully it's a win-win.
Any questions? Seeing none, all in favor?
Aye.
Any opposed? Carried.
Thanks, everybody.
Thank you. I have a resolution proclaiming March 2022 as National Colorectal Cancer Awareness Month in St. Lawrence County. Some of you may or may not know, but they recently changed the recommendations for colon cancer screening.
I will move the
motion.
I'll move the motion.
Moved by Mr. Avery, second by Mr. Reagan. I apologize, Steve. They changed the recommendation from first screening at age 50 to age 45. They realized we were missing early colon cancers in that 5-year period. There's some information that I would like to put up on our website that people could access, and just to draw attention to it, so people will make sure that they see the difference, the new screening recommendations. Any questions? Mrs. Haggard.
Thank you very much. It's in the first whereas, it says it's the second leading cause of death. Isn't cancer in general the second leading cause of death, or is this particular cancer the second leading cause of death?
This would be the second leading cancer cause of death. We could amend that. What second leading cancer?
That I think for that, because it's kind of scary with it being the second leading cause of death.
And so I moved it, Reagan seconded it. Cause of cancer death. Thank you for picking that up.
Rita, you'll have to vote on the amendment
Okay.
too.
All in favor of the amendment?
Aye.
Any opposed? Okay, any other questions? Mr. Reagan.
Madam Chairman, I just want to thank you for introducing this. A lot of people don't know I'm a survivor of colorectal cancer. I was lucky enough to, despite the recommendation of getting tested when you're 50, I got tested before I was 50 and discovered that I had an advanced case occurring, and because of that early test, and because of the early treatment that I got and the surgery that I underwent, I've been cancer-free for 15 years. Over 15 years. And I would strongly urge people 45 and older to get tested early because, as has been pointed out, It's the second leading cause of cancer death. And if people get tested early and discover it, science today can fix it. And not all cancers can be, they can't save everybody with a lot of cancers once they get too advanced. I was one of the lucky ones. And I'm, very grateful for the healthcare professionals who helped me and who operated on me and who made sure that I'm healthy today and who have checked me out, every year, couple of years to make sure that I continue to be cancer-free. But, it's important, it's vitally important that people not wait until they're 50, that they not wait until they're older to undergo these tests, because if they catch it early enough, they can address it and make sure that you can live a normal and healthy life afterwards. So I just, as someone who is, was able to survive what could have been a deadly disease, I can't emphasize enough to people that they get tested and save their lives.
Thank you, sir. Does anyone else? Mr. Smithers?
Yes, thank you also. Absolutely right, Jim. In our family, my wife's family has a history of this, and two of our daughters were treated in their late 20s, and thanks to early detection, they're doing well, still being treated. My wife's sister delayed treatment, and she passed away 2.5, 3 years ago now, because she delayed getting when she knew that there was trouble. So absolutely right. As with other cancers, early detection is very key in this. Can't be emphasized enough.
Get your screening done. Anyone else? All in favor?
Aye.
Any opposed? Thank you. We go on to Vacancy Review Committee with Rectal.
Good evening. So this evening you have 8 departments in the summary that you looked at. Out of that, I can report to you that there have been 86 positions total requested since my last annual report in August. And we are looking right now at a 91% immediate fill rate, approximately 4%, 30 days positions are held, and a 3% or I can give you that number. Actually, it's also 3.49% held or withdrawn. There have been 9 abolish and create, so essentially a net zero positions. And I'd like to keep you informed of the number of vacant positions at any given month. In this month, looking at our 839 positions, there are 7.8% of those positions that are vacant when the report was pulled at the beginning of the month. So I think that's a good number to be familiar with. In 2021, I also like to remind you of the permission you granted above and beyond the probationary fill, which allows positions that were filled less than a year to be filled again to prevent long-term vacancy in that spot. And in that role, there have been 37 for 2021. And also you extended the authority granted to me for the temporary positions, which can occur for a variety of reasons, and there have been 28 of those. So very helpful to two departments to continue through that process for repeat fills for after short term, either probationary period didn't work or they have elected to move along. And the temporary positions also either help prepare someone for retirement for someone new coming in, or just allow us in a situation where we may need some additional help. Public health has been an area in extraordinary need. We've been able to utilize that function as well. But the first up for this evening I just want to clarify, I believe the undersheriff is with us. We do have the added physician and what will change, the family nurse practitioner positions on your desks and emailed to those who are joining us electronically. Those are added, but those were addressed in the resolution. This is just the vacancy component of that. Just want to make that clarification before we get started with the jail staff. Undersheriff?
Thank you, ma'am. So the first position is the sergeant position at the correctional facility. We're looking at a retirement of the sergeant on March the 2nd of this year. And obviously due to the New York State Commission, we are mandated to have 6 correctional officer sergeants in the facility or on staff and on payroll. So we're looking to backfill that sergeant's position.
Questions for Sean?
Anything else?
Okay, next
Right.
one.
All right, this next one is a corporal position. This is, we've done some budget analysis, the jail administrator and we've located, one platoon in the jail has no corporal. So we have a couple of sergeants and a corporal on the day shift and on the evening shift, or excuse me, the midnight shift, but not on the 3 to 11 shift. Well, we did a cost analysis, and the approximately $1,900 difference to abolish and create a correctional officer into this corporal position could lead us to a potential savings of $12,192 net savings based on the amount of shifts and the overtime that we've paid, as we just previously discussed in the overtime amendment to the budget. So we're looking to abolish and create that position to help us out.
Questions for this change from the undersheriff?
Yeah, just the base salary, it's $47, I'm sure that's just a typo. Do we have a number for that?
The base salary for the corporal?
Yes, I think that's what he's asking for.
Yes.
47,418.
Thank you very much, whoever answered. Okay. The corporal step 10 is 63,727, and the correctional officer step 10 is 61,839. Typically, it's a senior member of the office, hence the reason why we did the difference of the two, the 61,839 and the 63,727. The net difference of $1,888.
Other questions?
Anything new? Before I forget, I would like to mirror the county administrator's thoughts and appreciate the board and as well as her, especially going through the time of the vacancies that we're going through. Obviously, you can see the list of 8 that we have here. That has been a tremendous help to us to make sure that people are able to attend the academy in a timely manner. So giving her that authority has certainly been helpful, and she's helped us out tremendously with that. The next one is the physician assistant, or excuse me, the physician and the nurse practitioner. As previously stated, Dr. Kring has agreed to become our facility doctor under Correction Law 501. It's mandated by the state that we have a doctor on file. And as I stated, there's also a nurse practitioner that's agreed to take on the responsibilities, both for $1,200 a month and the rates of $75 for in-person and $50 for telemed visit. We don't anticipate these costs rising above $54,000. These are per diem positions.
I want to say that's really inexpensive.
We thought so too.
As well as continuity and coverage, which they have not had the luxury of in some time.
Yeah, good people and they're being kind to us.
So
Yeah.
Undersheriff, I'll just kind of precursor these next 4 vacancies
Yes.
with these discussions have been underway for both of these initiatives for a long period of time. I believe the school resource deputy discussion's been ongoing for at least 5 years that I'm aware of, but I think long before that as well. And looking to move into that arena, into that program with a district so that all of the issues or concerns, each district is unique, but being able to do this with one district to begin with is helpful to the sheriff's office, along with so many of the things that are happening right now. But also the board already authorized the acceptance of, at budget time, we talked about the COPS grant and the importance of the drug task force having an additional member. So these vacancies are really the ripple effects of those initiatives moving forward. And so I wanted you to understand that the temporary positions allowed the folks to join the academy in January, and they will be finishing up. Sheriff certainly can speak, undersheriff can speak to that more in detail, but these will be the positions they will hold and their backfills. So undersheriff, go ahead.
Yeah, so I'd actually like to restructure the dominoes, if you will, probably for ease of following. So if we could go with number two first, is fill the detective position. This is what starts this whole domino effect, if you will. So this is, as the county administrator explained, this is the COPS grant. We applied for this grant last year. We were one of only 6 agencies in the state to receive this grant. So we're pretty proud of that fact. $125,000. This is a Department of Justice grant, and it certainly will help the drug task force. Since the restructuring of our office, the drug task force went from 2 down to 1. So I know the sheriff and I are excited to have another set of hands to further our drug enforcement and epidemic. Additionally, this position will also have to continue the community outreach. I'm not saying that, we can always do better, and we want to enhance that, especially hopefully on the downside of COVID. We can do that a little bit more proactively with some of the non-for-profits and community services and that. So this detective position is extremely important and very sensitive, but certainly worth every penny, in my opinion.
Questions on the COPS grant? Okay.
So that was the number 2. The number 3, if we're following along, due to this position and the importance of this position, we've had a sergeant come forward, and he has decided to take a demotion from sergeant to detective. So with that being done, the sergeant we'd have a sergeant opening. So we'd be looking to backfill that sergeant's position with the passing of the COPS grant and the detective position becoming permanent.
Questions on that one? Okay, next one.
The next one would be, so if we were to take a senior member of our office, a deputy sheriff, he'd fill in the sergeant's position. This would obviously fill the deputy sheriff position. One being in the temporary position that I spoke about earlier. This would make that position permanent for us.
Questions on that one? Okay.
All right. And lastly, like the county administrator spoke regarding the school resource officer. Yes, this has been a long time coming. I've been with this office a long time, and there was a time when we were able to be in the schools more proactively. As we all know, we were in the certainly lean times, and very fortunate that the school, Edwards Knox, has decided that this is in their best interest for their community, and we're happy to engage and have them part of our organization, if you will. We do have some meetings scheduled with Edwards Knox next week. Either the sheriff or myself will be down in Edwards Knox speaking with the community and the school board about this position. And we're moving forward to make this a permanent deputy sheriff position.
Questions on that vacancy? Okay. Thank you, Sean.
Thank you very much.
Did you happen to bring the jail count with you?
I did. 109, two correction officers and 2 inmates, COVID positive. The inmates were not in the facility. These were all new admits. And just another number that the sheriff and I were speaking about today, staggering, we're the highest in the state. We love that crown, right? 194% increase over our sentenced inmates. So we went from 11 to 50 sentenced inmates. So we're getting a lot of inmates right now that are going to be with us for a long period of time. And it's unfortunate, but it is what it is at this point. But 194% and take the crown. So
Thank you, Under Sheriff. Any
Thank you.
questions?
Happy to
Okay,
answer.
have a nice night.
Thank you. You too.
Next up, we have our district attorney.
Good evening, everyone. Chief ADA Sarah Sharpent here in for DA Pasqua. We are looking to fill a Secretary 1 position. The person that has left our office, with February 11th being her last day, had been going to school, and she has now received her degree and is kind of moving up to fulfill that career path. She was a long-term employee that handled a lot of our discovery subpoenas, motions, things like that. So we're just kind of looking to fill that in for now.
Questions for Sarah? Okay, seems like you got off easy tonight, Sarah.
Okay, thank you very much.
Thanks for joining us. Take care.
No. Okay, on to committee reports. Agriculture and Farmland Protection Board, Mr. Denisha.
You got one more
Oh, I'm
resolution.
sorry.
Gambling.
Oh,
Well,
well, that actually came on my thing after committee reports.
Committee
It was
reports is
number 9.
first. Yeah,
It is.
you're right.
Good.
You're right.
Sorry. We'll get there, it's on my list. Go ahead, Mr. Denisha.
We had our last meeting Thursday, October 3rd. A lot of discussion on candidates to replace the vacancies on the Agricultural Protection Board. And I think the thing that was really noteworthy is we had a moment of silence to recognize one of our long-term members of the Ag and Farm Protection Board, Reggie Shack. Next meeting is Thursday, April 7th.
Thank you very much. Alternatives to Incarceration Board, Mr. Burke.
There's nothing new to report. There have not been any meetings.
Thank you. Board of Trustees for the Supreme Court Library, Ms. Fiasco.
Nothing to report at this time.
Thank you. The Emergency Medical Services Advisory Board met again, and shockingly, we discussed how we're going to get enough people to run the ambulances in the county. The people who run the ambulances and work on them every day from the different towns have no interest in the plan that Jonathan and those guys put together to try to have the county have its own service that does anything. Their argument is if we start hiring people and paying them, then no one will want to work for them, and then it'll all be taken over, and they want to come up with an alternative way to do it. They didn't have any suggestions on that. I understand their thought process. If we hire 6 people, it's just gonna be 6 fewer people that they have, but there has to be some motivation for people to do this again. The people in the SENA, their ambulance service that was privately paid, had a long-term, I think it was a 5-year contract with the Akwesasne tribal people. And they just decided at the end of 2021 that they were done with it, which left them with no dedicated service. And so they're going through a process right now of offering tuition for people to go and be trained, and then they'll pay them when they're done. And it'll be a paid service there in the tribal lands. But I think we're headed towards paid services. There's very few places anymore that have volunteer, and we certainly don't have enough volunteer people. They're going to go back to the different ambulance services and discuss it to see, you know, what do they really want to do, because they're either going to have to get together and come up with ways to talk people into doing this, or we're going to have to move forward. But there's calls that take longer to answer than we would like them to. We have a number of people that have retired during COVID and just aren't doing EMS at all anymore. So we have to think about how are we going to serve the people of San Lorenzo County. We'll get back to that. Our next meeting is, I believe, there's one in March. The Environmental Management Council, Ms. Terminelli.
Thank you, Madam Chair. We had our last meeting on our last meeting was technically January 19th, but 2 days prior to that, we were fortunate enough to be able to gather together and have a Black Lake project meeting. And this was attended by several different organizations, representatives from several different organizations that either have interest in work on Black Lake or have previously done some work studying. And it really was almost a coalition as a way to come together and share information. And it became very apparent from that dialogue that there's a huge need for a central warehouse of information. We're kind of getting to the point that we're finding that we think we need to do this, this one thing at Black Lake, and come to find out there's been research done on that. So that was the really big takeaway. Some of the people that were in this at this meeting were Bill Kirky from Rates, and they have some real-time sensors in both Black Lake and in Rossi, and they use that to monitor dissolved oxygen, but those at a hefty price. There are sensors that can be designed to measure other things that maybe they could get some readings on that would give us some parameters to continue studying the presence of invasives in Black Lake. Luke Gervasi was there. He is the ecologist that works with GEI Consultants. That's currently working with SLILO Prism to survey invasives and come up with some kind of a plan to tackle those. They're doing a monitoring and data compilation, and then they'll be reporting that stuff back out. Bill Dashnaw was there, and he's the president of the Black Lake Chamber. Sue Rao, which is the chair of our committee, the representative. Brad Baldwin was there from SLU. He's done a lot of work studying different watersheds in Florida, the Bahamas, Chesapeake Bay. So he was there, and that was actually our presentation for our full EMC meeting as well. And just speaking about what he sees as some of the challenges and possible solutions in Black Lake. Lauren Townley from DEC was there, sharing what the work that she's done on the phosphorus levels at Black Lake. Brian Washburn, the chair of the EMC, was there, of the Watershed Management Committee. And the purpose of that was because the draft plan was something that he had created, and the groups had worked on it or looked at it, and they will continue to work on it as a team. And then Lee Harper from River Edge Environmental. And Lee has done some work in Mud Lake and Goose Bay using herbicide treatments on aquatic invasives there. So just kind of all these just great leaders that have had some interest in the area. So hopefully they'll be able to come together, compile their data, and work on this watershed management plan and invasive species management plan for Black Lake. And there is a nice FOLA, the Federation of Lake Association annual conference is being held this year in Lake George from April 29th to the 30th. So they encouraged all the members to attend that.
Any questions from Mr. Terminelli? Seeing none, thank you very much, Nicole. The Fire Advisory Board, Mr. Denisha.
Fire Advisory Board was scheduled to meet last Thursday, but it was postponed until Thursday, March 10th.
Thank you. Intercounty Legislative Committee, I forgot where they met. They had a bunch of resolutions that came in from other counties, mostly that were urging the preservation of the congressional districts. This was prior to when people voted. To keep them the same. They were very worried about how Congressional District 23 was going to be changed. Obviously, they changed it anyways. They had one urging Governor Hochul to reopen Gowanda Correctional Facility, which is in Western New York and kind of in her district of where she comes from. And then they had one that opposed Governor Kathy Hochul's abrupt, secretive, and unsafe prison closures on public safety, economics, and environmental grounds that Intercounty of Western New York had passed and sent. They wanted it to be passed across to our district too, but they didn't take action on it. And they did not pass any resolutions themselves. The next meeting is next week, Thursday. We have the jury board, Mr. Sheridan.
Thank you, Madam Chairman. The jury board did not meet since our last meeting a while ago.
Thanks, sir. The planning board, Mr. Fay.
I have a number of items to speak about. The first one I'll talk about is a new brewery in Louisville. In-law Breweries is planning on moving their location to across the road, not 37, the side road, where Louisville Elementary School used to
I
be.
think that's 38 right there.
38? Okay, 38, and there was a couple of questions. One of the questions that's been centered is parking. Will there be enough parking? And the other question is their coding. There's a questions between brew clubs and brew pubs and clubs. There's a difference between the two. And as the code reads at the present time, the lower level for the club is 15,000 gallons. And for the upper level, it is 10,000 gallons, I should have said, 15,000 barrels. And there's about over 30 gallons in a barrel. So I think they have to look at the code there a little closer. So there's two items on that project they're looking at. In Pierpont, we looked at a battery energy storage system. In Lisbon, we looked at the car dealership is now gone from Parkway to Capera. They're looking at adding a big pole barn, 60 by 120, to add 2 new franchises, like the motorcycle and recreation vehicles. That's being looked at. Oswegatchie, there's a small 8-lot development on basically next to the Augsburg Golf Course. And the item that was really ended up within controversy is a solar project in the town of Madrid. And since I've been on the planning board, almost all of our solar projects have been approved, gone through the planning board. We have passed a resolution that says we should not be putting solar panels unless necessary on prime farmland. And it was pointed out at this meeting that this is about as prime a farmland as we have in St. Lawrence County. So there was a big discussion on it. I contributed to it. And basically, vote really almost was unanimous that we did not approve this, although the planning board and Dakota Cassidy made a great presentation, and he said it was probably the most well-prepared presentation that we have received since I've been on the planning board. But it was voted down because we as a group said we do not want solar panels on prime farmland. So that probably is one of the biggest vote downs I've been a part of since I've been on the planning board.
Does anybody have any questions about that? Mr. Denise?
Not a question, but a comment. Thank you, Danny. That's, remember a month or so ago, when I gave a report on agri farmland, there's been 250,000 acres of farmland in New York State over the last 10 years. It's gone. It's gone to solar arrays and wind. 250,000 acres. We had a gentleman in here a few weeks ago that gave a talk on peaker plants. And the amount of land that's required. Peaker plant, I think he said that they take anywhere from an acre to 5 acres to generate 50 kW of power. And for solar to generate the same amount is thousands of acres. It gets to a point where we've got to have the farmland. We've got to have farmland for cattle. We've got to have farmland for plants for crops. And eventually we'll get to the point where we don't have any farmland in You can't eat electricity. So thank you for planning board.
Anyone else? I just have a quick question. Did they get anywhere in discussing what they're gonna do with the store in Morristown that got crashed into and had to be torn down?
No, it was not gonna be for
Oh, they are going to let me go? Okay. Somebody called me about that. I couldn't do it. Okay. So nobody has any more questions. We'll move on to old and new business. I have a resolution that came in proclaiming March 2022 as Problem Gambling Awareness Month in St. Lawrence County. Moved by Mr. Denisha, seconded by Mr. Forsythe. Who can speak to this one?
This resolution actually was also passed in 2021. We've received actually communication most recently today with regard to having some additional information provided to you for the board meeting, but also to shed light on one of the challenges that we face. Having a reservation with a casino nearby brings additional light to this issue. One of the areas I think that they're pursuing also is yellow lights to bring awareness to problem gambling. So certainly something that we felt important to shed some light on this month.
Mr. Akers?
So when you turn on to watch the news or your local news, Channel 7, Watertown News, or whatever, constantly the public is hit by ads about gambling, about lottery, and exciting life, and anybody can be a winner.
And the new online game.
So, well, the new online gambling. So much of what's been touted for gambling, at least for the New York lottery system, is that money is supposed to be going towards education for the schools. I'm not so sure that's actually happening. So they're coming up with a plan here to treat gambling, but they're actually promoting it. So it's a mixed message. And it's not helpful for people out there. Young kids are seeing this and it looks exciting. It looks sexy. And this is New York doing it to themselves.
Mr. Forsythe?
Last information I remember from about 2010 was about 10% of the proceeds of gambling go to school education, about 10%. It's a mixed message without a doubt. Super Bowl was yesterday. I can't imagine how much was bet. Me, nothing. I didn't even watch it, but that's fine. It's a mixed message, and I don't think there's an answer for it. We rely as a county on revenues that we generate from the casino ourselves. Where story, I guess.
Anyone else? All in favor?
Aye.
Any opposed? Okay, so carried. We have need for executive, but
After services.
after services, okay, so then I would look for a motion to close. Mr. Forsythe, seconded by Mr. Reagan. We're done. Moving on.
Thank you.
Thank you.
That was Richard. I didn't see it.
All right.
I believe so.
Well said, Dylan? Yep. Call to order the February 14th, 2022
meeting of the St. Lawrence County Board of Legislative Services Committee. And I will entertain a motion to approve the agenda. Mr. Venetia, seconded by Ms. Curran. Discussion, all in favor? Aye. Any opposed? Carried. I would also entertain a motion for approval of the minutes of the meeting of January 24th, 2022. By Mr. Forsythe, seconded by Mr. Perkins. Any discussion? Seeing none, all in favor? Aye. Opposed?
Aye.
Here. We will start off with public health. The first resolution authorizing the chair to sign a contract with the New York State Department of Health for the lead poisoning prevention program grant. Is there by Mr. Smithers, seconded by Mr. Akers and Mr. Perkins. Julie Munger.
Thank you. So this resolution will allow us to accept the grant funding for the next 5 years. We did receive an increase this year of $13,671 for the total of $49,500. Part of the increase is because in October of 2019, the blood lead levels that we monitor in children was reduced from 10 down to 5, and we were given no additional funding because it was during a current grant cycle. So for some counties, the state has increased that, and we were one of the counties that did get an increase. 4 counties throughout the state actually had their grants decreased, so we consider ourselves fortunate to have that increase. So the change will allow us to catch up our funding for the work, and then we are also anticipating during this grant cycle for that blood lead levels to change from 5 down to 3 to align with the CDC.
Any questions or comments? Seeing none, all in favor? Aye. Opposed? Carried. The second resolution is authorizing the chair to sign a memorandum of understanding between the St. Lawrence County Public Health Department and Dr. Lisa Kirby, veterinarian for rabies clinics. Is there a motion by Mr. Akers, seconded by Mr. Perkins and Ms. Curran? Any, Jolene, go ahead.
Thank you. So our previous veterinarian has retired, so we are looking to contract with Dr. Lisa Kirby for our rabies clinics. We also use their license for providing our rabies vaccine, monitoring supplies, certificates, everything around our clinics. Just so you guys are, for some statistics, in 2021, we had 16 towns plus our clinics and Friends for Pound Paws participate. We did a total of 1,655, which is up from 2020, where we had 1,065. 2019 pre-COVID, we had 3,101. We also had 21 towns. So during 2022, we will be working to try to increase the number of towns participating again, to try to get those numbers back up. But we would like to have another veterinarian for that.
Any discussion or any questions? Seeing none, all in favor? Aye. Opposed? Carried. The next resolution is authorizing the chair to sign a contract with Health Research Incorporated, New York State Department of Health, for epidemiology and laboratory capacity, enhanced detection and modifying the 2022 budget for the Public Health Department budget. Moved by Ms. Curran, seconded by Mr. Ganesha. Go ahead, Julie.
Thank you. So this is to, we were awarded an additional $1 million for our existing grant. And this contract does go through March 31st of 2023. So we have just over a year to use the money. Some of the costs that we have associated with the grant currently are all of our vaccination supplies, the additional staff that we have hired for our vaccination and contact tracing, and it helps covers the cost of the overtime for our department. It can be used for those existing, for anything around testing and or vaccination efforts going forward for the next year.
Questions or comments? Mr. Smithers.
Down on the page, right above where it says therefore be it resolved. Says the funding will be expended on hiring of permanent staff to assist with POD activities, POD clinic supplies. What does POD stand for? Which one?
POD is a POD is a point of dispensing. So that's what our currently their vaccination clinics. Previously, our emergency preparedness grant, we run exercises throughout the county with the helps of other county staff. So currently, so it's a point of dispensing. It could be any type of item that has to be dispensed through the community. Right now, we are basically just doing the vaccinations with it, but it could be switched to any type of, it could be medications, it could be supplies. It's just a point of dispensing.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is accepting performance incentive achievement award funds and modifying the 2022 budget for the public health department. Moved by Mr. Smithers, seconded by Ms. Curry. Go ahead, Joanne.
Thank you. So we have received an incentive achievement award for $34,000 for a perfect score of 100% for our education and promotion of expedited partner therapy for chlamydia and gonorrhea. So we will be using this funding to support any Article 6 eligible funds, and we will we're going to start advertising a little bit more for these services. So over the next couple of months, you may hear some advertisements for our STD and HIV clinics on the news and media.
Any discussion, any questions? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a contract with Dr. Danny Sikon for pharmacist services for the public health department. Moved by Mr. Smithers, seconded by Mr. Perkins. Go ahead, Jolene.
Thank you. So our previous pharmacist, Dr. Garuda, also retired. Dr. Garuda worked with us for the last 14 years. So Dr. Skihan has agreed to become our pharmacist. We are required to complete twice a year audits for our medication that we keep on site, and it's quarterly. In case any deficiencies are found, they would have to come back the following quarter. But typically we haven't had deficiencies, so we're at twice a year right now, but we do have up to 4 if necessary.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. And you have a few minutes for a discussion on physician services. Joanne.
Okay, so we will be bringing a resolution next month for Dr. Como. So our physician services have increased with what is required of our medical director over the last several years. We are changing our standing orders on a regular basis for all of our COVID vaccinations and our COVID testing that we are required to do in the schools currently. And if we do decide to shift towards a county testing option, it would be our medical director that would be overseeing that. So he has, Dr. Como has been on call for us on a regular basis, sometimes multiple times in a day, signing our standing orders as the changes come out. For example, the CDC just modified considerations for those who are severely immunocompromised to their booster waiting period down to 3 months. So it requires a update of all of our standing orders to modify the language and for him to review and sign. Our medical director also signs all of our immunization and STD standing orders that we are required to provide. He also oversees all of our communicable disease. So in the case, say we had a meningitis case, he would be the one to help authorize the treatment and contact tracing and treatment of the individuals associated with that individual. We are starting to see a greater number of other communicable diseases outside of COVID within our department. So just bringing some awareness that the role of our medical director is increasing as our duties to the community in Article 6 increase.
Any questions or comments? Mr. Burke?
Jolene, we've certainly heard a lot about COVID in the last couple of years, but what is the current state of affairs with STDs?
So we do have, I don't have the numbers right in front of me. We have seen an increase of STDs, including syphilis. That's been a big one that has increased in our county. We don't see a lot of people actually coming into our clinic, which is one of the things we are hoping to increase or draw more awareness to, the fact that we do offer the visits on a weekly basis. We offer clinic visits on Mondays. Our rates, though, across the state and the county have not decreased. They have increased as people seem to be less concerned with using protection or having multiple partners.
And a
I can
follow-up.
have the numbers for the next meeting or send them out to you.
Are primary care physicians treating? Is that your assumption?
So it is more commonplace. There's less stigma now with going to your primary care to be treated. More insurances are covering it. So between primary care or your gynecologist, Planned Parenthood, those providers are all, for the most part, handling it. Several counties have gone to contracting with Planned Parenthood to provide that service.
Thanks, Jolene.
All set, John?
Yeah, all set. Thank you.
Anyone else? Mr. Ray?
What steps do we currently take to publicize these clinics?
So right now they really are just on our website. We also work with Freedom House and Grace House. That's where a lot of the referrals come from. And the service is on our, like I said, on our website. So we are going to be shifting now that we're reducing some of the COVID workload, which has shut down a lot of our clinics because we haven't had the ability to provide those services. So we will be doing ads on the radio and newspaper for the next several months to try to increase awareness of the service that we can provide.
Follow up, Mr. Chairman?
Go ahead.
Thank you. Years ago, the Public Health Department used to, every month, send out press releases to the media to let the public know that these clinics were being held at various places. And the media, used to cooperate in running them. And the Public Health Department used to get the announcements placed on the various coming events columns, carried in most of the media groups in order to keep hammering home the fact that the county was holding not just this kind of clinic, but also the other clinics, the other services that the county provides, like immunizations for those who are going on trips and other important services that the Public Health Department provides. So I would strongly urge you to consider reinstituting that program in order to reach out to the community and make more people aware of the important services that the public health department provides. And if you need any help with that, I'll be more than happy to provide some advice and assistance on, how to go about doing that.
Thank you. I will reach out for that. So right now we're looking to advertise our STD HIV clinic because we have a nurse practitioner that we contract with for services that provides that. For immunizations, the travel immunizations have really gone down. We're not able to get the yellow fever immunization anymore. So that's one of the biggest ones that people would come in for. For our regular immunizations, we have cut back on how often we are providing that. We are currently down to, we had another resignation. So on our preventative side, we have 1 RN and we have 3 openings now. So I have 1 RN to oversee our rabies program, STD, HIV, lead, and immunizations. And so we are going to be reevaluating and shifting some programs around, but our immunizations are currently on an appointment basis as needed. And then once the school age children open up, because that is a service we do have to provide, we will work to get the school age children in again and pull. We have so we're down to 3 full-time RNs in the department out of 6.
Anyone else who hasn't spoken? Go ahead, John.
Jolene, what does the pool of candidates look like for nurses?
We really don't have one. One of our nursing positions has been open for the last 12 months. It was vacated due to a retirement December of 2020. And we had one RN that was a public health nurse that was in for 4 months, and she resigned due to pay. And we had the one resignation today. She's been in the role for about 18 months to take a position at a physician's office.
Will you be working with Ruth and Johnny to try to address that, Jolene?
We have been working to try to address it, and we will be reaching out to the college again. We've been advertising. We've had a few over the last year, a few applicants, but when we get close to offering them a job, they get an offer back at where they were. We lost one back to St. Lawrence Health for an extra $30,000 a year.
Thank you.
But I am working with both Ruth and Johnny to determine different avenues for recruiting nurses.
Thank you.
Anyone else? Seeing none, all in favor? Oh, excuse me. There's no resolution for discussion. Jolene, thank you very much for your time and your explanation of these. We appreciate it.
Thank you.
Thank you. All right. We'll move along now to community services, Jay Ulrich. And the first resolution is modifying the 2022 budget for community services for renovation of the mental health and addiction services clinics at the Human Services Center. And a notation that this resolution was was tabled at the January Services Committee and would need a motion to remove from the table. However, I would say that the county administrator approached me and asked that this remain on the table and that she wishes to address it in executive session. So unless there is some disagreement with that, that will be the case. And seeing none, so be it. So the first resolution is still on the table. The second resolution is authorizing the chair to sign a contract between the Children's Home of Jefferson County and the St. Lawrence County Local Development Unit for the provisions of health home care management service dollars and modify the 2022 budget for community service. Moved by Mr. Smithers, seconded by Ms. Curran. Just Jay?
Good evening and thank you. So this resolution has to do with care coordination for AOT patients. So assisted outpatient treatment patients that need community-based services. And one of those includes care coordination. So we had 2 shared state staff workers, and I don't know how far it goes back, I mean years, that they were paid by St. Lawrence Psychiatric Center, and they were shared and housed in community services. And about 3 years ago, one of those individuals retired, and they did not replace that individual. And then more recently, last year, the other shared staff person went out on extended leave. So we worked with OMH to, try to cover this caseload, so to speak, because they're high risk and, need this resource. So we shifted the current caseload that the provider from St. Lawrence Psychiatric Center was servicing. We switched that to our in-house case manager, but we also needed some additional support for these individuals in the community. So at the time, we looked at who was, it's called specialty mental health designation for care coordination for AOT. So it's a special designation. At the time, the Children's Home of Jefferson County was the only designated provider. So we reached out to them and they agreed to take on any new cases that our current case manager could not provide services for because her caseload was full. So the overflow is now going to Children's Home of Jefferson County. And along with that, the State Psychiatric Center had state aid monies attached to those originally 2, then down to 1 position. And I asked that those funds be transferred to St. Lawrence County to the LGU so that we can disperse those as needed. So what those funds are for is it's service dollars, and it's around $10,000 that the county is going to get and $10,000 that Children's Home of Jefferson County is going to provide those individuals with basic needs. So this could be bedding, it could be furniture, it could be bus vouchers, it could be grocery, coupons or to buy groceries, could be whatever the clients need. So we have $10,000, and this resolution only addresses the children's home because the other monies is going to be used by the county. And then in addition to the service dollars, there's around $8,000 that will be used to provide these same services to those individuals who are on an AOT but do not qualify or have not yet signed up for Medicare, or Medicaid. But yet through this program, they would be eligible, and these state aid monies would pay for those services rather than billing the Department of Health because they don't have Medicaid.
Any questions or comments? Mr. Burke.
You're muted, John.
Good.
Jay, were these the old intensive case managers positions?
Yes, they were. Yeah.
Well, that was always slated to be the most intense form of case management that was available for mental health services. I'm wondering, is there that level of skill with the Children's Home of Jefferson County to be able to do that?
Yes, I mean, I was working with Lindsay Newvine, our mental health services coordinator, who runs SOA, and they have a significant number of AOT patients in their county, and they seem to do a fine job. So in terms of their case management services, we feel that they are quite capable of providing this service. Yes.
Is that anything that we would look to do in the future, Jay?
Well, I mean, like I said, we split the caseload. We took the existing, and then any overflow from new AOT court-ordered referrals, we had to give to the children's home because we didn't have the capacity in-house. So, I mean, we could, add, and it's been talked about, adding another care coordinator that has this specialty mental health qualification. But there is additional training for this, yes.
Thanks, Jay.
Anyone else? Seeing none, all in favor? Opposed? Carried. The next resolution is authorizing the chair to sign a contract with Citizen Advocates for the Mobile Access Program, clinical assessments, and modifying the 2022 budget for community services. Moved by Mr. Perkins, seconded by Mr. Forsythe. Go ahead, Jay.
So the police, mental health, and community collaboration out of Rochester released some grant funding for a mobile access program. And, as the DCS, I was, somewhat scrambling to try to find out or figure out who would be the best provider to be able to do that. And, we had outreach to other providers to provide this service, and they didn't have the capacity. So what this entails is there's going to be 4 iPads that are given to the sheriff's department, and there's going to be 1 iPad that's going to be given to a service provider. And when a police responds in real time in the field to a behavioral health crisis, if appropriate, they are going to dial in to the clinical service and then give the individual the iPad so that they can communicate with a crisis counselor about what is going on with their behavioral health situation, and they're going to do a real-time assessment. And then when the assessment is complete, the clinical person will talk to the police and advise them in terms of the disposition for what options they have for providing care. So, I mean, that might be, depending on the situation, it might be that they're arrested and they go in front of arraignment. It might be they're taken to Claxton Hepburn to the 939 emergency room for a psychiatric or a crisis evaluation. And if appropriate, a subsequent psychiatric evaluation for admission into the inpatient unit. It might mean that they're diverted to the behavioral health urgent care that we're hoping is going to open up late February, early March, or it may be that they're referred to just community-based services, outpatient services for follow-up. So it's a triage tool for law enforcement to use in the field. And again, there was a grant for this, and the agency that had to apply for the grant would have been the clinical agency. And, it was determined that it made sense that Citizen Advocates was the clinical aspect of this project because they're going to have the 24/7 behavioral health urgent care facility online by the time that this grant rolls out and becomes online as well.
Questions or comments? Seeing none, all in favor? Aye. Opposed? Carried. The next resolution is modifying the 2022 budget for community services for funding received from New York State Office of Mental Health to St. Lawrence County as pass-through funding to approved agencies. Motion by Ms. Curran, seconded by Mr. Smithers. Go ahead, Jerry.
So this is one of our standard resolutions, and we passed one last month for the downstream provider funding amount for the contract funding amount. And at that time, we had the 2022 OASIS state aid letter. We did not have the OMH state letter. So these numbers have been updated to reflect the increases in the 2020 OMH Office of Mental Health state aid letter that's going to be going down to the downstream providers for funding of those services.
Any discussion? Seeing none, all in favor? Aye. Opposed? Carried. Jay, you have some clinical updates for us.
Yeah, we have the clinic updates. So, in terms of highlights, I mean, the no-show rate went up, 1.3% on the addiction side. Overall, the no-show rate went up just only 0.6%. That's going to wax and wane depending on the weather. A lot of different factors. So the clinic counselor visit averages, last month they were 6.43. This month they were, of all clinics, last month they were 5.70. This month they're 5.42. So that's down a little bit. But I also wanted to remind you, these addiction service and mental health visits per 7 hours is not weighted. So that's based on the counselors, how many people the counselor saw on average on a given day during these two pay periods. But that does not take into consideration whether they took vacation, whether they had sick leave, whether they were quarantined, things like that. If you look at the weighted services down below, that does take into account those factors. So the addiction services this month was 63.6, last month was 62.7, a very modest increase. And for the mental health side, we were at 73.1, whereas last month we were at 67.8. So combined, if you take all clinic services, in December we were at 64.7, and right now we're at 67.03. So this does, wax and wane, but we're up just slightly this month. And again, the goal being 72%, so we're slightly under that clinic-wide. The prescriber visits, they remained fairly flat. On average, it was 8.8 for 7 hours. Last month, we were 8.75, so pretty much the same. In terms of the wait list, we continue to have 80 people on the wait list for the mental health clinic. We do have a candidate that we are soon going to be actually transferring rather than hiring. This person recently got duly licensed. She was a CASAC and then went on and got her master's degree in counseling. And she's opting to move over from the addictions clinic into the mental health clinic. So when that happens, which would be very, very soon, within the next month or so, that number should be dropping dramatically, if not almost in its entirety. So, in the meantime, we continue to reach out to those individuals to see if they want to remain on the wait list or they want to be transferred to another provider. So, I remember I spoke last month about we had offered the mental health counselors to be able to do some trainings that were being paid for by a grant, and for them to do them on their time, and then the grant would actually pay for any comp time or overtime they used to complete those trainings. Initially, they really didn't want to do that, but they have decided that they would be willing to do some of their trainings on their off time and get compensation for that. So that's good. In terms of, I believe it was one of the legislators, I believe it was Mr. Burke, asked whether or not they would be willing to work either comp time or overtime to go, to try to decrease the number of people on the wait list. And that was not something they had an interest in doing. But I think that merely reflects, to the point that we're only have 3 mental health clinicians, and they're really pulling a lot of weight, and I'm not saying they're struggling, but they're pretty taxed in terms of their ability to take on additional caseload at this point. So in terms of, I don't know if we have any questions on that.
Are there any questions? Ms. Curran has a question.
Hi, Jay, sorry. Your prescriber visits, are they also doing the psychotherapy?
They are on the mental health side, not on the addiction side.
So if they're a mental health provider, they're doing the psychotherapy and the meds. And if they're on the addiction side, they're just doing the med. How long do they get for a med management visit on the addiction side?
20 minutes, typically 20 minutes. I mean, it's not hard to predict, but that's on average, it's 20 minutes.
So then of the prescribers that we have here that see 10 and 7 hours, how do we know who's doing, are they doing both? Like both the med management and psychotherapy and med management for addiction?
Well, the first bar represents the medical director who is there 1 day a week. In addition to seeing clients, she also has to sign off on treatment plans and clinical assessments. So that's kind of wrapped into her hours. The second one is the individual that's providing the MAT services for the addictions clinics. That would be Suboxone primarily. And then the last is predominantly the mental health provider. That individual also spends a little bit of time, few hours a week, providing MAT services when needed.
All right, thank you.
Mr. Burke.
Jay, are we still offering telehealth?
We are offering telehealth. Obviously the clinicians are in their office, but I would say 85 to 90% of the services we continue to provide are telehealth. Yeah.
That's great. Thank you.
Wow.
Sorry, additional question. On our waiting list.
Well, wait just a second.
Oh, sorry.
Is there anybody that hasn't spoken that wishes to speak? Go ahead.
So on our waiting list, can we get that broken out by who's waiting for med management for like MAT or addiction versus who's waiting for like med management and psychotherapy, just so we know like how many, not who, but how many people are waiting for which?
Yeah, I mean, we can get those numbers, certainly. I mean, with the addiction services, there's 13 on the waiting list. So whether or not those individuals are going to require medicated assisted treatment, we're not 100% sure until we actually bring them in and assess them. When they're on the waiting list on the addiction side, that means that they have a scheduled appointment, but OASIS has set the bar at 5 days. So if you can't see them within a 5-day period, they're considered to be on a wait list. But all those 13 individuals on the addiction side do have scheduled appointments. On the mental health, sorry.
But they're out past 5 days.
Yes, but not a lot past 5 days. It's not like we're booking them 2, 3, 4 weeks out. So it's a little bit past the 5-day mark. And that's again, that's the bar that OASIS sets. So that's why we say that they're on a wait list.
even though they do have an appointment. So
Okay,
on the
thank
mental,
you.
so I mean, on the mental health side, I mean, the assumption is that most of the individuals will be assessed, and at that point, the therapist, along with the individual receiving, the services, will make a decision on whether or not they want to try psychotropic medication, for whatever mental health issues that they're having. So that's more of a process. It's hard to say how many of those 80 individuals are going to need medication until they're seen.
Also, anybody else? You have anything further, Jay?
I don't believe so. No.
Well, thank you very much.
All right.
We will move on now to social services and Heather Rand. And the first and only resolution is modifying the 2021 budget for social services for administration, medical assistance, temporary assistance, and services. Is there a motion? By Mr. Forsythe, seconded by Mr. Fay. Ms. Rand, go right ahead.
Thank you. Good evening. So this resolution is to modify the 2021 budget, and it's due to unanticipated increase in the cost for childcare and state training schools or Office of Children and Family Services facilities, higher various local revenue, lower local weekly medical assistance cost, and lower safety net cost. So again, the increases that you see in the appropriations are due to the cost associated with those board rates for youth that are placed in the OCFS facilities, along with an increase in adoption subsidies that are related to the number of youth that we are currently subsidized through adoption. There are decreased appropriations, particularly pertaining to safety net, along with increased revenue in several areas that offset the increased costs and appropriations and decreased safety net revenue here.
Any questions? Ellen? Seeing none, all in favor? Aye. Opposed? Carried. Heather, the floor is yours.
Okay, hoping that Dylan will share my data with everyone. So good evening. This is the first report for social services for the 2022 year. And there we go. In January, Child Protective Services saw a slight reduction in the number of intakes or calls to the state central registry that were received. We were down 9 from December. And additional 336 unique children are being served under those reports. That's significantly lower than the 372 children that we added last month. So if we look at our indicated, unfounded, and family assessment response, we do have a decrease in the average indication rate from our 17% to 10% for the month of January. This could have included some closures related to the new state central registry legislation that changed the burden of proof, as you recall, on indications from some credible evidence to a fair preponderance of the evidence. However, I doubt that that includes many of those cases since we're just in the first month of the year. Our family assessment response cases were also down from 20% to 14%. And as a result, we saw an increase in the unfounded cases to 76% from 63%. If we take a look at our safety checks completed on time for December 2021, because the state data is 1 month behind the local county data, our safety assessment checks completed on time were 92%. Which is still higher than the state average, but we continue to strive for the 100% of assessments being completed, entered into the connection system, and approved by supervision within the 7 days as required. Again, St. Lawrence County has been performing better than average. And just a comparison, a year ago,
from this data, in December 2020, our safety assessment response rate was 70% for St. Lawrence County. So moving on to the average CPS caseload. Again, we are continuing to stay steady at about 25 cases on average per worker. We haven't really seen much fluctuation or change in the last 6 months or so. The OCFS, as you recall, does recommend a max caseload of 15 and continues to measure counties throughout New York State that have caseworkers who carry more than 15 open investigations at one time. So our total caseload, total open cases, is 738. This is up just slightly from 729 last month, and we were able to close 124 cases this month. And looking at the cases per month by supervisor, I'll just try to point out some of the more glaring things. I just want to note employee in the first unit, 3856, just want to note that the employee 8588 is no longer with us. That was a self-selected out probationary individual. So in looking at the individual units, you're going to see that some of the caseworkers have slightly higher, or in some cases, significantly higher caseloads than others. This could be a result of experience, ability to complete particular types of investigations, areas of the county that receive the highest number of intakes, the complexity of cases, resignations, or medical leaves of workers that will have had significantly high caseloads. The last three staff that have left us have left 124 cases that needed to be redistributed to other workers. So the unit continues to look for opportunities to provide protected time for paperwork, such as a week off report, to help some staff with the more egregious workloads. In looking at unit 5478, just want to note that the individual 7636 closed 20 cases last month and 5 this month. That's an individual that's been off for several months for medical, so other staff have been handling, managing, and closing those cases out. That unit is primarily our training unit, and typically our new workers that are onboarded into CPS go into that unit as well. Although since we've had several, we've had to spread them out a little bit. So in looking at unit 6035 and 7255, I just want to note that these are newer supervisors who were promoted that had caseloads when they were promoted, and still you will see their numbers listed underneath in their unit. So they are still working on closing some of their cases in addition to attempting to manage their unit as well. We look at the trainee period. We have 3 caseworkers that will complete training April 15th. I'm happy to say we have 4 caseworkers that will be starting February 22nd. We did have 1 resignation in February. Their last day was last Friday, the 11th. The department, and along with Human Resources Department, is working on gathering and securing exit interview information to help provide some more insight into the causes for departures. The most common cited issues noted by staff in discussing the reasons for leaving with probationary staff and longer term employees continue to include caseload size, complexity of the work, and simply it not being the right fit or job for them. So again, if we look at closed cases, probably the most significant is employee 5463 who resigned and left us. So a lot of those cases were closed prior to her leaving or redistribution to other workers and closed as well. So in moving on to the foster care and preventive services data, the number of children in the custody of St. Lawrence County did increase in January from 302 to 311. Sometimes when sibling groups are required to be placed into care, it does impact the data. We still have 25 youth that are home on trial basis that remain in the custody of the county, but are home with family. Our net change to children in care, we discharged 3 children from care in January and added 12 for a net change of 9. The average number of children in care, although less than the average for 2021 at 311, we're still striving to reduce that number. Looking at the average days that children have been in care, it did go up again from 695 to 741. So as you may recall, in the past couple of reports, we've discussed the number of days in care with a little more detail. If a child's road to permanency involves adoption, for example, a child will remain in care 15 out of the most recent 22 months prior to the filing of a termination of parental rights petition. This is approximately 450 days in care. After filing the termination petition, holding hearings, ensuring service on the parents, and completing the court process, it's likely to include another 180 to 365 days, bringing the average length of stay between 545 and 815 days in care. So we're continuing to strive to be closer to the lower end of that number, but we are remaining within that range for long stayers or children whose permanency continues, whose permanency outcome will likely be discharged to adoption. And looking at the average number of children in the home that are receiving preventive services, this includes voluntary and court-ordered preventive cases. We are down 14 cases in preventive services from last month. The reduction in those cases could be the result of the increase in complexity, resulting in children needing to be placed outside the home, or from families seeking community services on their own, or for the lack of available services to prevent the placement of the children. As I previously mentioned, we would like to see this number actually increase and serve families under preventive services. This would allow and support children remaining at home while addressing the needs of the family that brought them to the attention of the agency. The average caseload remains 12. There is not a whole lot of change across the 4 units for foster care preventive staff. You'll note in unit 660, we did have 1 worker that reduced 11 cases. Those 11 cases were actually distributed to that unit and the other 4 units due to maternity leave. And that worker will be coming back and joining us in the home finding unit, so they will not be returning to their caseload. Just wanted to point out that unit 3660 is our adoption and foster care unit at the top of the next page. And that has remained pretty steady as well. And I think we will discuss the adoption numbers pretty soon. The home finding unit, we did see a loss of 3 kinship homes this past month. St. Lawrence County still maintains approximately 110 certified homes, and Fostering Futures or Children's Home of Jefferson County maintains around 84 at the last update. That's a total of 194 certified homes serving St. Lawrence County between the 2 agencies. So we do have one employee in training for foster care preventive at this time. We have, including tonight's vacancies, we have 8 vacancies, as we had an individual accept a position today, and I believe they're split between foster care preventive and child protective services. And as I mentioned, we have 4 workers starting in a week and a couple starting at the beginning of March as well. And if we look at the cases closed at the bottom, again, the 11 cases are listed there, but they are actually not closed. They're distributed across to the other workers. So other workers see an increase while that worker sees a decrease. So if we look at the adoption activity, we do have a new family court judge who is just taking the bench at the beginning of the year. We did not have any adoptions for the month of January. We do have 7 adoptions pending with the court currently. We have 7 additional adoption packets that will be completed and filed with the court within the next 2 weeks. And in 2021, St. Lawrence County saw 35 adoptions. So in looking at the summary of our foster care placements, I'd like to provide you with an update regarding our family first requirements. St. Lawrence County continues to meet the state and federal requirements for family first. Our institutional rate needs to be below 8%. We're currently at 5%, which is actually a bit higher than our typical average of 4%. Relative and kinship homes needs to be above 50%, and St. Lawrence County is remaining steady at 55%. A brief update on our DSS employees as foster parents. Currently, we still have 6 DSS employees that remain foster parents for the county. 2 are relative resources. There are 6 St. Lawrence County youth that are being fostered by DSS employees. That includes 1 relative. This is approximately 2% of the 311 youth that are in St. Lawrence County custody. Employees make up, again, about 3% of the foster home population between Fostering Futures and St. Lawrence County Department of Social Services. So if we take a look at our eligibility programs, there are similarities in the number of cases and the number of individual cases as well. We see a decrease in the number of TA cases in both overall and for individuals, and an increase in all 3 other areas: SNAP cases, medical assistance cases, and HEAP cases. Last month, I did mention that St. Lawrence County Employment Unit had been preparing some data for you, and I do hope to have that data to you next month for your review as well. And that's the data for January.
Any questions? Okay, Mr. Burke.
Heather, is the availability of foster homes, is it getting better or is it remaining the same? What is the status?
For very hard to place youth, I would say that it remains a struggle. What we are improving upon is at the onset of the process, when Child Protective Services is working with the family, we have been, because we have 55% of our youth in kinship homes, we have been doing a very good job of locating and finding either kinship or people with significant relationships to the children to be considered for placement. But as far as for very difficult youth, it remains a challenge in St. Lawrence County for sure. And we do have some of our youth are placed outside of the county as well. And we would prefer that all of our youth remain in the county.
Any idea how many are outside the county, Heather?
I can definitely get that. I don't want to throw out a number.
Well, and the other question I have, Heather, is that high turnover of staff. Do we have a plan, or will there be a plan to address that? And again, this isn't just to you, Heather. This would be to Ruth and Johnny as well. It seems like, you know, that continues to be an unhealed sore that we're trying to deal with.
So I believe that there are potentially a task force or bigger things happening at the county level to address retention. And I would certainly defer to Ruth to talk about that. I would say the number one thing that will help retain staff for child welfare is to get the caseload to a place where people feel confident and competent in their ability to do the job and do the job well. So I think there is a big light at the end of the tunnel, because we have more positions than we have ever had to be able to fill. And we are working very hard to try to fill them. But we do, unfortunately, in the meantime, see a few people leaving. So
you know, we're playing catch up, but I do believe that we will get there.
Thanks, Heather.
Anyone else? Heather, thank you very much.
Thank you.
We'll move on now to the vacancy committee review.
So Heather won't go very far. We have 3 departments that'll be presenting this evening with positions. The first will be social services. I think one of the things, and I believe Heather mentioned it, but I would reiterate, the addition of positions also provides the mobility within the department, right? So we've created senior caseworkers, we've created more grade B supervisors than we've ever had, and then in creating the director of services last year. So the cascading effect, and you'll notice in the vacancies you have in your packet tonight, some of those vacancies are a result of promotions. And certainly in some of the conversations we've been having more recently, when we're moving people up, we want to make sure that they're prepared to provide that supervision. And when your average tenure continues to decrease because of retirement, among other reasons, you want to make sure the people prepared to supervise can do just that. One of the things I think in the trainee block that we have yet to see is 5 new employee numbers in that process. We've seen, I think, at most 3 at any given time. And one of the conversations we had last week was about the fact that if you have 5 out of every 5, 1 may not work out for their own reasons, or 2 with the workforce challenges we face these days. There may be up to 1 or 2 that don't fit the work or at the discretion of those being supervised by. And then you may end up with 1 or 2 that make it all the way through that process that end up actually becoming caseworkers. So when you have those types of odds, and we can certainly run the numbers and tell you what ours looks like, each time a month goes by where those 5 slots aren't filled, we're behind again, as far as I'm concerned. When you're also looking in this packet tonight, you have a retirement included. So that also is not something necessarily we can plan for. We can blame it on the work, but if they're retiring, the assumption is they've been with us for some time. The challenge then is bringing someone in behind them that has that level of competency and capability. So there's a balancing act, I think, but the board's given the tools. I think we had up until December, we had 4 positions that had yet to be filled from April. So that alone is a big deal to get all the slots filled. Now, what happens once they're filled may be another matter. They may choose not to stay. We may choose they're not going to stay, or they stay and they're successful. So I believe we're on track now. We're getting through the exam scores down into the 80s, 85s, I believe. We're exhausted. We're getting down into the 80s and 75. So those lists continue to be vetted. We have seen a little bit of a delay associated with the SCR credentialing at the state level. I'm told if folks come in from other states and apply, that may take a little longer. So there's a number of thresholds we need to clear in order to have these positions filled with people once they have taken the exam and they're reachable. So there are any number of thresholds that if we have any challenges along the way, complicate getting a caseworker who can carry a caseload competently with adequate supervision. But on all fronts, I think those have been identified to the board and assistance has been provided at every level. And now it's a matter, and I think I heard Heather say this morning in our meeting, the supervisors are very excited. I believe 4 start tomorrow, 2 start the first week of March. So there's 6, let's say we keep all 6. Life gets much better more quickly for those who are carrying the caseload. But the reality is, with the statistics we're looking at, that may be a different story. But they come in, we want to get them oriented. We want to onboard the best we can and have the folks that we're able to hire ready and set up for success. That being said, I did just want to mention, because there had been a couple of inquiries with regard to the exit interviews. Those are loaded on your Google Drive under Human Resources. So you can take a look at those. It's grid format, so you can go across and see a variety of the answers and prompts that are provided by HR. Often, if the department's not successful in the way that folks depart, HR can reach out or complete that exit interview with them. And just a, sort of a fun fact, the reality of numbers that we're looking at when we look at an average associated with exit interviews is less than 30%. So the reality of the times we're living in, those percentages have dropped between 10 and 15%. And so when we look at who's sharing with us, amicably leaving, we're getting the information. We do have some of it, and certainly something to always strive to get more information and feed our process for what we need to do to improve. Any questions on that piece? So if you have any trouble finding it, let us know. We'll help you find that on Google Drive as well.
Mr. Akers?
Well, just a comment. You know, being a caseworker, I'm sure is a tough job. I mean, they say things that nobody wants to see, and I'm certain that they go home with that, and they go home to their families with that. But the fact remains, since 2018, we had 217 children in care. And last year we had 321. It's a 50% increase. So we've added over 100 kids. So I don't know if it's a delay on the family court side, but this is a societal thing. You know, I don't think it's just germane to St. Lawrence County. We've got severe problems about and people's ability to parent their children for whatever those reasons are, which they vary for sure. So you know, we're on the defense here. We're actually providing services to these children, and I don't know where you attack it on the other end of it at the very beginning, whether it's churches or schools, parenting classes, or just our culture in general and how it's evolving. So, you know, we're on the back end of this. You know, we're patching the leaky boat, and the boat is left the dock. To start out with, whether it's poverty or just certainly it's drug addiction and societal problems that I don't know where the answer is, but we need to get back to less kids in our care for sure for the good reasons.
Mr. Burke?
On the issue of exit interviews, they are our employees unless they walk off the job. And I'm wondering why we couldn't sit down with them if they don't want to. I mean, I guess I don't understand how we would not get a piece of paper filled out while they are still our employees. I mean, once they've left and are no longer our employees, I guess we don't have any leverage. But I would think that when we know they're leaving, we should be able to collect that information. And again, unless they walk off the job.
Who wants to comment? You or Heather, you want to comment
Yeah, I
about
think Heather
that?
can speak to that. It does happen on some occasions.
Yeah, we've had this conversation before, and I think that maybe you can enlighten us and John as to what some of the problems are.
So I know just recently, that is literally what happened is a couple of people came in and handed over their keys and left. We also have people who are out on medical. I know recently, our most recent resignation had gone out on medical several weeks prior to. I reached out to her personally, tried to have a conversation, said that I thought that it would be better for the whole. We get better ideas about why people are moving on, and no response. So I certainly agree that if people are still here and give their notice, that we need to make it more of a priority to ensure that we're sitting down with them or having them complete the form prior to leaving when they're still an employee with the department.
Thank you.
Anyone else?
So moving in now to the vacancies. Heather, do you want to speak to the keyboard specialist first?
Sure. So the keyboard specialist position is vacant as a result of a promotion for our keyboard to a secretary position in Child Protective Services. So this keyboard actually manages 2 units right now, one foster care preventive unit, one adoption foster care unit.
Questions?
No questions.
Okay. Heather, do you want to speak to the caseworkers in whatever order is preferable to you?
So I put them in the order that they're on the agenda. So this is our worker who vacated
last Friday, the 11th. So it's a resignation, and the person, I wasn't able to speak with them regarding the reasons for them leaving, but they are an employee who has been here for several years, since 2011. So likely caseload size, burnout.
Questions? Okay, next one.
So the next caseworker is vacant as a result of a reassignment. In the spring, we had 100% turnover in our home finding unit. So we needed to interview and move a staff person to home finding to be able to assist in that area. And this individual actually transferred from Child Protective Services into home finding to provide services for us there.
Questions? Okay, third one.
So the third one is a promotion. This is a senior caseworker position that was filled for the training unit. As mentioned, we have had 6 promotions, 5 being new positions, and 1 the creation of the Director of Services that have resulted in 6 caseworker vacancies throughout the last year. So this is the senior trainer position that's going to help our other senior trainer work with all of our new staff and continue to provide education and support and training to our child welfare staff moving forward.
Questions on this one? Next one.
So the next one is the resignation, and I believe it is due to retirement. This was a employee as well, and they were able to retire and they chose to do so. So that's why this Child Protective Services position is vacant.
And last one.
And the last one is our other promotion that, again, we had someone move up into a grade B supervisor position, opening up their senior caseworker position, and this caseworker moved into that senior position. They will handle specialty services cases, the multidisciplinary team, and provide extra assistance, perhaps on fatality reports, things like that. So,
any questions? Thank you, Heather.
Thank you.
The next vacancy to be considered, and this is from Community Services, so Jay, I believe, is with us, is with regard to filling the MAT component, the medical assisted treatment at the jail when that comes online. Jay?
Yeah, this is a vacancy authorization request for a registered professional nurse. If you'll notice that it's not, we're getting $160,000 from the state for this purpose of a mandated MAT service in the jail. This position was not designated as specific to those funding. Rather, this is going to be county cost. We're not really sure how this is going to unfold in terms of the number of individuals in the correctional facility that are going to warrant this service. So this may or may not be a half-time position, so to speak, in community services, the other half being for the correctional facility to augment their current nursing staff. But we're going to have to see how that plays out. So again, we have $160,000 of state aid monies. We're anticipating a county cost of approximately $190,000, but we really won't know until we get the program up and running what those costs are, because some of those costs include the actual cost for the medication that we're going to be dispensing in the correctional facility. So the primary responsibility of this individual is going to be screening and the dosing of medicated assisted treatment,
which would either be Suboxone, Sublocade, methadone, or Vivitrol. Are there any?
I don't think we can hear you in the boardroom.
That's fine.
Go ahead, John.
Jay, we heard from public health about their inability to recruit nurses. Do you think, I mean, it looks like the base salary is pretty much the same as what they were offering. And I wonder, as we talk about, you know, especially methadone, but any of those drugs, it would be good to have somebody who is well seasoned to take this position. I don't know what your thoughts are, but I do wonder about the starting salary and your ability to recruit.
Yeah, I mean, certainly that is a concern. We currently have a clinic manager that's really a nurse manager. So that person will also be helping oversee the dispensing in the correctional facility. And, hopefully being able to mentor any new nurse that's coming in for this task. But I mean, yes, I understand your concerns because nurses that are on the road in response to COVID, they were making quite a bit more money. So it may be a hard fill.
Thanks,
But
Jay.
I think there's also probably some nurses that have had a very difficult time during COVID and may want to leave some of the hospital systems for a job that may not, create the same exposure. So.
Anyone else? Mr. Perkins. Thank you, Mr. Chair. We've talked about the nurses and the salary and how hard it is to get them. We tried negotiations to change some of the grades and the salaries, but it was not accepted on the other side of the table. So we did try to increase that, just so you know.
Thank you.
Any other questions or comments? None.
Thank you, Jay.
Thank you.
The last group for this evening is public health, request to create and fill positions. Hi again, Jolene.
Hello.
Go ahead with the public health specialist.
Okay, so this position is to take a temporary person that we've had as a public health specialist who has met the time frame that we are able to hire for temporary to keep the individual as they are already trained for the duration of the grant. So this individual helps oversee all of our vaccination clinics along with staffing and vaccine transfers. She also creates a lot of the vaccine media and education that we provide on Facebook. The vaccine grant is also written that the individuals are allowed to work on any immunization. So as the year goes on, we will be shifting her to update some of our immunization material that we have not been able to update due to COVID and our workload over the last couple of years. So she will be primarily COVID focused, but switching towards all of our immunization education throughout the remainder of the grant. And we anticipate keeping her in the position through May of 2023.
Questions for Jolene on the public health specialist? Okay. Community health nurse?
So the community health nurse, both of the positions, the two community health nurses are identical. So they are part-time positions, again, to take our temporary staff that have been working with us. We actually have 2 retired community health nurses from the public health department that have been helping out, first starting with our COVID investigations and now primarily working on our vaccination efforts. One of them provides the majority of our homebound vaccines. The other one helps out with our in-house clinics, and they also help with our COVID hospitalization data with the communication with the hospitals. So we are looking to keep them part-time so they can work up to 35 hours a week as our efforts increase wane throughout the rest of the year.
Questions?
And this is grant funded as well underneath the COVID grant. So they are grant based.
Mr. Forsythe.
There's no option to work more than 7 or 8 hours a day in any of these positions. These are all 5 day a week, I'm assuming.
So these positions work when our clinics are. So we do have the occasional nights and weekends clinics. So they do have a somewhat flexible schedule based on what's going on for the day. So on our, and I don't anticipate having much more need right now for a large vaccination clinic, but I don't know what could come. When we do host those clinics, we typically host them for 8 hours a day, and there's usually an hour setup, hour takedown, all of that time in between. So there are some days where they will work longer. On the times when we do our school clinics, if we try to get all of our school clinics in a short time period due to holiday breaks based off from when vaccines become available, sometimes we have to do long days to get all of the clinics in. And then when we do homebound vaccines, once you open a vial, they're only good for a certain amount of hours. So the vaccines have to be used within that time period. So depending on how many vaccinations are being done in a day, it could be in the evening if we have extra vaccine for the day and we have somebody that is willing to take it. We don't like to waste vaccine when we can put it into when we can give it to somebody. So they do have the ability to flex their schedule a little bit, but within the community health nurses are limited to working less than 35 hours.
Just follow up.
Yes, go ahead.
Are per diems allowed into that? Would per diem, or do we have any option for that?
So my understanding is that per diems can only work up to 30 days in a year. So that limits us to their value, or not to say they're not valuable, but it limits us for how often we can use them for what we need.
All help is welcome.
And we also have temporary RN vaccinator positions still available on our website as well.
Other questions?
Ruth, is that 30-day rule, a county rule? Part of
The per diem component?
the contract?
I would ask Johnny to speak to that.
Or is that?
I don't think so. Jolene, are you referring to Department of Labor?
I will let.
Or Johnny's there. There's Johnny. Johnny, can you speak to that?
I may be remembering wrong.
Yes, no, you're correct, Jolene. The 30-day rule is in the civil service, it's in the CSEA contract. So it defines the per diems as, must work less than 30 days a year. So that's where it's coming from.
I mean, we might want to take a look next contract period about seeing if we can extend that instead of 30 days, something that's more useful. I mean, you guys know more than I do about contract negotiations, so I'm not going to poke my nose into that, but just a thought.
Thank you.
So, it's a signed contract, and it's out.
No, I know, I mean,
No,
it's
no, let
already
me-
in effect.
It's already in effect, but we have a labor management group that could presumably take a look at that. If the union was willing to come to the table.
Well, I'm just tossing that out because I know other healthcare institutions are using temps longer than 30 days. So,
Perhaps that's a
I don't know
question.
if Johnny
that
had her
could
hand
be
up. I think Johnny
posed.
had her hand up, of course.
Yeah.
Anything.
Other hand?
Well, yeah, so I could just talk to that a little bit. So the union obviously wants union paying dues members, and per diems would not be a new union paying due member. And they also want benefits for these employees. So they are not generally ever open to extending any per diem length of time. And speaking of that, also temporaries, they have a very strict limit on the number of, or how long a temp can be there, which is less than 6 months. And that is on purpose as well. And it's not something they like to talk about. They do not want to extend it. We've talked about it before with them, but they want union dues members, and they are not represented in that contract. So when they hit those limits, they then turn over into a union member, which would have to be either full-time or part-time, regular.
Mr. Burke, did you have your hand up again? Go ahead.
Yeah, I did. On the other side of that equation is the county's responsibility to provide services, whether it be community services or public health. I guess I'm wondering, and I have a great respect for our union, but we're in a very precarious position because if I heard Jolene correctly, some of the clinics that are really important to public health may be compromised because of our inability to secure staff. And I think, I'm not looking to tag anybody, whether it's the people that did the negotiations. I mean, that's not the issue. The issue is we have a responsibility to the public. How are we going to fulfill that responsibility?
Anybody else? Ms. Curran?
I think that the county has done a valiant effort in advertising these positions. I think the problem is what I talked about, 6 months ago? You got a board up where it says, okay, I've got this many positions at $80 an hour. We can't get anybody to move to come to Syracuse. Okay, now they're $90 an hour. Still no takers, $100 an hour. I got a friend of mine who's been a nurse for 2 years is working at Upstate for $110 an hour. You're not going to get people to take part-time per diem jobs until this little board of craziness that they've got going on in the nursing world stops. I could go work as an RN and make more money than I make now, 3 days a week, 3 12s in an ER, with much less responsibility than what I have when I work in the ER now. And literally, they just don't have bodies, and these institutions are getting federal grants. And I mean, one of the hospitals locally has 50% of their staff is Air Force medics and stuff that have been brought in from other states. So we're that short that if you have an RN license and you're willing to answer the phone at some of these facilities, $75 an hour to answer the phone, because they need bodies to flip people, turn people. It's not about the unions, it's not about how many days can you work, it's the people are there, are gonna go to the higher paying jobs, and many people have retired, and the lines for nursing school are not long, not like they used to be. We have to kind of, we've been in panic mode, and look what we're gonna do with the nurses for so long, and they're gonna get these jabs, and they're gonna do that, and they're gonna do it, or they're gonna be fired. that people are just like, you know what, I can go cut hair and make $35 an hour and nobody's gonna tell me what to do. And we need
Well-
hairdressers. That's it.
Anyone else?
Thank you, Jolene.
Thank you.
Okay, we'll move to the county administrator's report.
Yep, a few updates for you this evening. I'll start out with the statistics related on a short update on COVID. Today in our COVID call, we were provided with an update on the percentages as well as the boosted population. Our positivity rate, according to the DOH, is 6.7%. Our per 100,000 is 374.98. Remember, just a couple of weeks ago, it was over 800. So we are seeing a significant drop in those numbers. Again, we have updated our new COVID center with statistics. We've received some real positive feedback on the information being shared. We will continue to improve the information provided. I did want to mention that coming up this Friday, we're going to step back our efforts on mapping associated with the towns and the region. We believe this held greater value earlier on in the pandemic, and it is an extraordinary task to plot, in some instances, 200 and 300 cases per day, to have essentially each town, each county illuminated because cases are everywhere. So we believe that at this time, coming up this Friday, we're going into the February school break, that we'll step back from mapping. They certainly have the talent to do it. But we think we can better deploy their time. And if there's a need going forward to return to this, much like we've done in the past, we've amped up our reporting to include the weekends. We've scaled back when that's appropriate. So we're going to take some time and take a look at that and just see if there's other, like the new COVID center, if there's other areas that we can be reporting on and information that we can provide. That's certainly something that we'll take a look at. Wanted to let you know the percentages associated with our vaccinated population on a full vaccinated basis. Our overall county percentage, we finally hit 60%. Our 5+ population is 63.2. Our 12+ is 66.5. Our 18+ is 67.3. And the 65+, always our best category at 85.2. The boosted population, so if you take the percentages I just gave you, within those percentages of those vaccinated, of the county-wide, the 60% I referenced is 54% fully boosted, fully vaccinated in that way, but also have their booster. 12+ is 56.8, 18+ is 59%, and again, 65+ is 79.6. Wanted to let you know that in our state call last week, our commissioner that's moved into this position with the new administration shared with us county, the region, I believe we're also in with the Albany County region, that we will start seeing approximately 4 times the amount of home tests arriving potentially on a weekly basis. So we are expecting just under 30,000 home tests this week. We always say that with caution until they arrive. But that is approximately 4 times, just under 5,000 test kits that we had been receiving. We received 2 shipments of those, separate from the amount we provided to the schools. And there was a question on our call today about asking, when you look at the expiration, and certainly that incentivizes us to push those out in the community, get those in the hands of folks, get those used. There are some that had a June expiration date. The expectation is with the test kits that will be arriving this week, that they should have a July expiration date. But that being said, looking at that many test kits coming in and already having possession of a good number of test kits, we are tentatively planning a distribution event like you've seen in other counties. We also had fulfilled a New York response request for masks of the KN95s. So those also will be available along with hand sanitizer. We do have some thermometers that public health is going to share with us. And we're going to look on Sunday to have a distribution event. So stay tuned for details. We're roughing that out now. It's looking like it will be in Canton. And then following, depending on the materials left out of that group of materials to be shared, we may work with our fire departments to push that out a bit further for folks who may not as easily get to Canton. So stay tuned. I'll make sure to share that with all of you, and we'll post that out, certainly with our friends in the press, to get that information out to the public. Did want to let you know that public safety complex, the designs associated with the renovations that we've been talking about are just about complete. Our intention is to call the Buildings and Grounds Committee back together to take a look at those, as well as consider some alternative options related to the energy systems, the heating and cooling in that building. One of the areas that I did want to address, no formal actions necessary, only if there's an objection, wanted to move forward with the hazardous materials survey in the public safety complex by putting out an RFP. And if you recall, in 2018, we did a hazardous materials survey of the old correctional facility. So we were remarkably interested in the fact that it came in much smaller. The identification of hazardous materials in the old jail was much smaller than we had anticipated. So potentially, if we could go ahead forward, put that out for RFP, receive bids associated with that, have the contractor come in and do both. That's one of the measures in the jail that's more easily completed, considering there's not a great number of materials there. But if that's something that I can move forward with, I certainly would appreciate that. We have our Buildings and Grounds Supervisor, Pat Hans, who's worked out the schedule, and that's the next sort of rung on the ladder of getting to the places where we need to in order to keep the schedule on task for us. So is there any objection to moving forward with that RFP?
Has to be done.
No formal action needed. We'll go ahead and do that. But I would like Buildings and Grounds Committee members, I'll be reaching out to schedule a time with you after we're able to get that group together, and we'll talk with our architect. Hopefully looking at March or April, to bring you, once that committee's convened and agreed with some recommendations, to bring you at least a preliminary understanding of what the Public Safety Center will look like post-renovation. Later this week, Jolene and I will be meeting with the Funeral Directors Association representative, Chad Green. In our interest in resolving the issue that we had last year with the autopsies having to go further than Dr. Livingstone, we have contracts in place with Monroe County and also down near Binghamton. Well, as you might imagine, that's an extraordinary commitment of time, as well as the unpredictability depending on the schedule for autopsies. Understanding that, and understanding that we have had a number of passings this last year, they've asked to meet and to go over. It's been a number of years since there's been any adjustment to their rate, but also to potentially talk about either a contract for this service and bring their suggestions forward so that we could bring them to you. So we're going to meet later this week, talk that over. I was able to meet with a couple of our coroners also to solicit their concerns and identify, going forward, we've talked about the challenges we face with a long tenured pathologist out of Watertown, and the options that we need going forward, one, to reduce those distances, but also to have something more local. So that meeting, as I mentioned, will happen later this week. I'll bring you something to our next meeting. That'll actually be the 28th, because we don't have a meeting next Monday, the 21st. Also wanted just to mention the ARPA committee met last week. That was a follow-up meeting to the finance committee where Clifton Fine Hospital presented. They went in a little bit more depth with regard to the financing component attached to their capital project. And also we had a pretty in-depth conversation about childcare and the importance of that issue in the county, in the region, in the state, and across the country. But looking again to meet here shortly, I'll catch up with members with the information who weren't able to meet with us. But also we did complete our reporting at the end of January, which was required by the Act. So that was, I think, a good conversation. Continuing, we hope in the very near future to bring you an update on what those plans look like. Wanted to remind you to take a look, if you hadn't already, Weights and Measures Director Adam Simmons shared some information with you about the super refund process, and also provided an update to you on a recent complaint that he received. If you have any questions or want to understand that better, please reach out to Adam. He's happy to answer your questions. Also wanted to mention our DSS commissioner interviews completed last week, the first round. We had 6 candidates. Our second round is to be scheduled for the next week, so toward the end of the week of the 21st. We have a great pool of candidates, and our hope is that we can bring you a recommendation by the end of February. And lastly, for my update this evening, we have a written report of a summary of activities from the Bonadillo Group related to the work that they've been doing so far. They've been on site in the county twice in December, once in January, and they are expected this week. They started their work with CPS, and they gathered a list of all of the cases, both investigative and FAR cases, and they reviewed 15. Included in those were open, closed, FAR, investigative, and indicated as well as unfounded. So they have a variety of cases they're taking a look at. Their plans this month with regard to CPS will include following up with caseworkers and supervisors regarding specific case questions developed during their review. They're also getting into the foster care with caseworkers and supervisors, as well as the foster care, preventive, and home finding units. You heard a little bit more about that this evening. They also are looking at both social services and our contracted entity, the Children's Home of Jefferson County, when it comes to tracking child movements, and as well as their indication and how their eligibility codes for board rates go. So the Title 4E foster care eligibility determinations are part of their work. And again, they'll be looking at both social services and the children's home. Their plans for this month include finishing, they've reviewed 9 of the 15 cases that they've taken a look at so far, as well as moving in more to preventive services. This week, the random sample of 15 cases in Prevent, they'll be working on when they're on site in the next few days. Questions? That's all I've got.
Oh, yeah? Okay. We'll move along to committee reports, the Board of Health and Legislative Affairs.
Okay. Well, one thing is things have changed in the last month. Omicron has hit, and Omicron has actually kind of been almost like a truth serum for the national politics and the direction here. First of all, just as a disclaimer, vaccines do work as far as keeping people out of the hospital. We know that 58, if you're unvaccinated, 58 out of 100,000 are more likely to end up in the hospital versus 4.7 if you're actually vaccinated. But what's come out of this is something that the CDC has known all along. They've known it actually even before COVID, was that cloth masks do not work. And so now they're actually recommending an N95, which actually is a class of respirators. It's at the very bottom, but it actually classifies as a respirator. And thank you, Ruth, for your efforts to actually get transparency on the county website. That's what some of my constituents have been asking about. And what it proves is that this is not a pandemic of the unvaccinated. As you can see, that the people that are ending up in the hospital are both vaccinated and non-vaccinated. So also now, there's finally this consideration about natural immunity, and that the CDC and the Medical Association is actually finally recognizing natural immunity, something that primary doctors have known forever for children getting diseases, measles or whatnot. And then also, finally, rather than looking at just strictly as vaccination as the cure for COVID, they're actually looking at pre-treatment protocols and actually the use of drugs and in off-label use. And what I've been saying all along is that public health is much more than just this COVID. And there's a recent study out of Johns Hopkins, there's a meta-analysis of data that basically pointed out that 0.2% of the deaths of COVID were prevented by the lockdown. And if you look at what happened during the lockdowns, you will find that it's been reported that 1 in 4 teenagers have actually considered suicide during this pandemic. We know that thousands, particularly in East Asia, have actually died of starvation. We know that the economic loss, that over 40% of the small businesses that closed during COVID have not reopened in this country. And we also know that it's a very low risk to children. So I don't know whether it's the politics or people just found out that with the Omicron, it was so ever present that they reevaluated how it's coming out. Maybe they just found out that the public won't tolerate it anymore. But the public health is meeting at 6 o'clock tomorrow night.
Thank you, Mr. Sheridan, Community or CDB Board of Directors.
Thank you, Mr. Chairman. There's not much new to report since their last meeting held on January 19th.
Thank you. Community Services Board, Ms. Haggard.
Thank you, Mr. Chairman. I did not attend the February meeting, but I do have an update provided by Mr. Ulrich. Our next meeting will be on March 1st, incidentally. Citizens Advocates gave an update on the behavioral health urgent care, the Crisis Stabilization Center. They're anticipating opening around March 1st. St. Lawrence Health System has opened an Article 28 mental health clinic in the Messina Hospital. I believe that has to do with people with developmental disabilities. They have 1 counselor and 2 prescribers that are going through orientation, and they hope to have a 2nd counselor available in the future. The Arc of Jefferson and St. Lawrence County is hiring vocational services specialists to assist special needs students transitioning out of high school. Transitional Living Services has purchased a vehicle with unused 2021 state funding for care management services. Jay told you about the additional $100,000 for MAT services for the correctional facility. I won't go over that again. And Claxton Hepburn plans to open an MC unit with 12 beds in March. And as I said, our next meeting is on March 1st. Thank you.
Thank you. Any questions? Seeing none. The Office of the Aging Advisory Board, Mr. Denisha.
Thank you, Mr. Chairman. Our last meeting was Monday, February 7th, 10 a.m. Few highlights. The holiday gift drive. There was thank the board for there were some nice donations that were given. But the holiday gift drive, there were over 250 older adults received items such as gift cards, gift bags, hats, gloves, blankets, socks, puzzles, safety space heaters, winter coats, pharmacy gift cards, and such with the money that was donated, which was great. Nutrition staff, they're still trying to hire folks. There's a vacancy for 1 permanent position and 3 temporary. 2022 plans, hoping to safely reopen congregate dining sites as soon as possible. However, it's going to be difficult because we currently have 21 home delivered meal routes. The 2022 Senior Award nominations, let me just give you a brief update. The nomination for Senior Citizen of the Year Award, and there was actually 2, Senior Citizen of the Year, and the second one is Outstanding Contribution by a Senior Citizen. Have to be 60 or older, and if anyone is interested in submitting a nomination, let me know or get a hold of Andre Montgomery and we'll make sure you get an application. Thank you very much.
Thank you. Would you have a question? Okay. Ms. Terminelli, the Youth Advisory Board.
Thank you, Mr. Chairman. Youth Advisory Board met last on January 27th. We highlighted a couple of the events that have been going on. We just recently wrapped up last week the Valentine card drive that was in partnership with the Office for the Aging, and I will give you an update on the number that we received when I have that, unless Ruth has that number. Also, the Youth Advisory Board has put out some press about the I Love My County Because. So NACO is having their annual art contest for their annual calendar. And so any school-age children can submit entries up through May 1st, and that was advertised in the I believe the January and the February newsletter that the Youth Advisory Board puts out, or the Youth Bureau puts out, and that gets disseminated to all of the districts in St. Lawrence County, as well as posted on their social media platforms. Upcoming May is Mental Health Awareness. I will be bringing a resolution probably in April to have approved by the full board meeting in May. They are going to be offering some virtual trainings through the Youth Bureau, as well as the Youth Committee. We're still working on recruiting some Youth Committee ambassadors. We're looking for representation, 2 students from each of the 18 school districts in St. Lawrence County, and that number is climbing. We are getting a lot of interest, and we have more than half of the schools represented, which is great. We're hoping to host a virtual workshop for political polarization that will be hosted by one of the Youth Committee members in March, end of February, beginning of March. Looking to the Trash Dash event in partnership with some of our county departments. Thinking April 30th is Global Youth Service Week. So the weekend of April 30th, but more to come on that. The Youth Advisory Board, the Youth Bureau does put out a monthly newsletter. We're always looking for content that youth may be interested in. So if you think of anything that comes up, that can be shared with Alexa Backus and she can put that in there. And like I said, these newsletters are shared with all youth organizations across the county, as well as with school districts and families, students. And our next meeting is on the Thursday, the 24th at 3 o'clock. And then the Youth Committee, our last meeting was February 6th. And an update on that, they reached out to all of the members to talk about the partnership for suicide awareness and prevention in St. Lawrence County with the U.S. Attorney's Office. They're looking at the prevention needs assessment that was gathered. More than 700 students responded. So they're looking at the data that was in there to compile some messaging, some PR stuff. So looking at posters and video campaign, and then in March and April, some teen-led discussions and presentations in partnership with our local school districts. The topics would include online extortion and suicide awareness and prevention. And they're actually offering some PQR training for the youth committee members. A gentleman named Ed Sachs will be doing that training with them on Monday at 10 o'clock to prepare them on how to provide presentations to their peers. So I think, investing in our youth and teaching them some fantastic skills that they can take with them into the next phase of their life after they leave the youth committee. And our next youth committee meeting is Sunday, the 20th of March at 4 p.m.
Questions?
And I do have an update. Over 3,000 cards were received from many classrooms across the county. And Channel 7, WWNY, just did a nice piece on it. So that aired tonight.
Thank you for that update. And thank you to the counties across the district that have supported this initiative, both this year and last.
We'll move on now to old or new business. Is there any old or new business? Mr. Forsythe.
I just got one question on it. It could be old, it could be new. It's the American Recovery money. I'm not on that committee, but my question is there been consideration given for like nonprofits, like Moose Oddfellows, different groups that depend on bingo and different things for the last 2 years and haven't been able to do that, like give back to the community? Is there going to be an application process? What is the plan? Should a certain percentage be allotted towards those types? Because I'm sure every community's got some. And I'd like to see what the plan is.
Mr. Forsythe, Mr. Akers is the chairman of the committee. Would you care to answer that?
Sure. So the effort primarily with this amount of money, knowing that the towns and the villages have gotten monies also, and everybody should be aware of that when towns make the request, is to actually look internal to what they actually got and actually what they'd be willing to do. Major projects, say for like the town of Canton, which qualifies with their water main, would be an infrastructure project. So what we will be receiving somewhere around, I guess, 21 million. The number keeps moving around. It was 20.8. I think we're over 21 million now. We haven't got it all. I think we have 10.8 or 10.4. 10.4. So the committee has met. I think this is the third time that we've met. Jim and Tony weren't able to attend Friday. It's a Friday meeting, it's a little tough. But certainly what the emphasis has been, I asked Ruth for projects that would be countywide benefit. That's kind of been the benefit of it. And so the committee, at least initially, we've looked at about $18 million of that spent on countywide projects. One of the things that would be considered probably is this child care initiative, is why we brought them in. Certain Clifton Fine, based on their geography and in the need for medical in that community, which they're about 40 minutes to an hour apart from any other major hospital where they could do any kind of, realistically do any surgery. Basically, they're stabilizing. I think they do some bones. I think they do a lot of stitching and with the snowmobilers and the boating, the camping crew that's down there in Star Lake. Your request, Dave, for the Lisbon Fire, the Legion, American Legion, has been sent to the other members. So the question is, we have about approximately $3 million left that hasn't actually been allocated, and that original 18 million has not been fixed position. We will bring it to you and we will talk about that. So it's considering how that last 3 million would be actually administered and who they would go to. We still have questions in our head about how that would be done. I think we're looking at, we spoke to Patrick Kelly of the IDA. They would have systems in place to administrate that $3 billion and provide the checks and balances. How those projects are selected and what kind of pecking order they are has yet to be determined. I think the emphasis should be, my own personal, is that those projects that actually qualify for the most for countywide benefit, knowing that the towns and the villages have already received monies. So Ruth knows I'm struggling with this. She and I are working on it together, along with the committee members, but that's the point I'm thinking. How do I explain to the board how this last 3 million? Because now actually the requests are coming in. Those individual requests from whether it's a lodge, a bar, or a tavern, or something else. So those are the tough ones. So Ruth, do you have a better answer? Or this is what we're struggling with.
But I think, the emphasis of all of this has been, how do we push as much money as possible back into the community? And also looking at areas of countywide benefit, like, for example, emergency communications. Everyone benefits from having better radio service. Everyone benefits across the county regardless. And so trying to figure out, with the infrastructure bill coming out, there's certainly a push for the highway, bridge, road, all of those types of considerations, but we're awaiting the final infrastructure bill to figure out how much is covered there, what is left. The broadband component is also big in the infrastructure bill. So there's, I think, a balance here that we're trying to make sure we aren't placing money where money already is and make those dollars go further. And I think there is an interest in figuring out those smaller requests that you're receiving, and certainly I'm sure every one of you have either been asked or inquired, is to get a process together for them, figuring that the IDA was interested as our economic developer. All of these have that type of component to it, whether it makes it easier to get there or it actually helps some of these businesses that struggled during the pandemic for a variety of reasons. And I think that component of it, we want to make sure everyone has a chance to be heard. Everyone has an opportunity to put forward either that they have a match or that they need the full contribution so that can be considered.
Yeah, and that, just a point to follow up, is in one of the statements, you said 40% of the small businesses have been reopened. It's probably the same for those, those groups. So that's a concern. And then I know we all got them. So I just think there should be something.
And I think if you get them, please send them along to me or to the staff in the office, and we'll make sure they're compiled and either presented to the IDA or that process as it's determined.
Okay.
Mr. Request.
Thank you, Mr. Chairman. From a procedural standpoint, though, unless I misunderstood Kevin's summation of the previous meetings, the full board will be voting on every single expenditure of that 20.9 million. Am I correct?
Absolutely.
Yeah,
Right.
Tony, the board will be, our committee will bring everything forward. And,
Thank you.
For sure.
As a recommendation.
Yeah.
Anybody else regarding this question?
As a committee member, I'll just give you an example. I had a phone call from a citizen from Ogdensburg and wanted to make sure we hopefully got electrical battery charging stations in Ogdensburg. And this is, we've got all sorts of requests.
And we're gonna have to do some real thinking as a board on how we're actually gonna divide it up. As the committee members, my comments. Anyone else?
Margaret has her hand up.
Is it still on this topic or are we moving on to other new business?
Well, you can move along to another topic if you wish, because nobody held up their hands to further this one, so go right ahead, Margaret.
Thank you, Mr. Chairman. I'm bringing this up tonight to ask my fellow legislators for ideas and also to make you aware of something I've become aware of through a constituent in the past week. And if we had an overriding theme tonight, and I've been listening closely, we have an employee shortage everywhere in very critical jobs. And it turns out that one of the areas that is very hard hurt in our county are group homes, residential group homes. These are for people with exceptional needs and developmental disabilities. Their parents or their loved ones live in the county and they visit and they see their relatives. And unfortunately, a lot of these homes are being consolidated because of the lack of employees to man the homes. Now, much of this has to do with the state and what they offer to pay. This is not a new story. We're dealing with it on many other levels, as you well know. But I did want to bring it to everyone's attention. I think it's important because it affects our constituency, and we have a lot of people that depend on this service. I would hate to see parents who have children in these homes or aunts and uncles, whatever the relationship is, have to go traveling to other counties for hours to see their children, to have visits. It not only affects the families themselves, but it affects the person that is in the home. They want to have a connection with their family, and if we can't have enough homes in St. Lawrence County, then it's a problem. But please keep this in mind. I'm going to try to find out more about it, but it was brought to my attention this week and I want to make everyone aware. Thank you.
Thank you. Anyone else? Ms. Curran.
We have the same problem with personal care aides. They used to go out to people's homes to help the elderly stay in their homes. We used to be able to, within a week, place somebody in the home that would go out and help with showers or shopping or all kinds of different things. Now we're telling people we don't have even the idea that we're gonna find anybody in the next 60 to 90 days. There's a lot of people who have decided to stay home and not go back to work because there's opportunity to stay at home and collect money so you don't go back to work. And there's so many people that are being, I think, prematurely sent to nursing homes because there's just no one to help them with their activities of daily life. So if anybody does come up with an idea for all of these people who are kind of teetering on the edge, it would be wonderful to hear.
Okay. Anybody else? Any other old or new business? Seeing none, we have need for executive session 4.
We do for litigation personnel, which is the medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, negotiations, and appointments.
Motion to go into executive session by Mr. Forsythe, second by Mr. Fay and Mr. Denisha. All in favor?
Aye.
What they need to hear.
We have two people who are currently the incumbents. We do Alex first, then we do Fred Carter, and then if there's a need to have a third vote, then we do that. But if we have two settled in the first two votes, then we get to adjourn and go.
Right, that works. Works. Okay, so we're in open session.
Yep.
What we need is somebody to move a name and second.
Sure. I would offer Alex McKinnon for reappointment to the Dank fourth grade 4-year term.
Yes.
I'll second that.
Second by Mr. Arquette. Any discussion? Mr. Forsythe.
Mr. Chair, Alex was one of the three candidates. We had three very outstanding candidates for the Dank Board. Our committee, which was comprised of Nicole and Larry and myself, couldn't come up with a consensus. The one consensus that I think we did come up with was Alex McKinnon. He's dedicated, he's a loyal member of this body, he's a dedicated member of the Dank Board, and I support him wholeheartedly.
Anyone else? Seeing none, roll call vote, please.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
15 yes.
The resolution is carried. The second name that we will consider is Fred Carter. And is there a motion to nominate Fred Carter by Mr.
Yes.
Reagan, second by Mr. Forsythe? Any discussion? Seeing none, roll call vote, please.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Recuse?
Curran,
No.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
No.
Sheridan,
No.
Smithers,
No.
Denisha,
No.
Perkins,
No.
Akers,
No.
Fay,
No.
Haggard,
Yes.
Fiaco,
Yes.
6 yes, 8 no, 1 abstain.
Mr. Carter's, his name fails, he does not make it. And that leaves one other candidate. Is there a motion to move it? By Mr. Akers,
Mr. Chairman, I'd like to nominate Mark Hall for a 4-year term to the Dank Board.
seconded by Mr. Forsythe. Any discussion? Seeing none, roll call vote, please.
Marquette,
Yes.
Terminelli,
Recuse?
Curran,
Yes.
Reagan,
Yes.
Foresight,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Taggart,
yes,
Piaco,
Yes.
Burke,
Yes.
14 yes, 1 abstain.
So the two appointees to the Dank Board will be, Mr. McKinnon and, Mr. Hall. Is there any further business? Mr. Chairman, Oh, go ahead, Tony. thank you. I was just wondering procedurally, when somebody recuses, do they or do they not have to identify a reason why A reason why? you recuse?
mm-mm.
I think that if you recuse yourself on a vote, that the procedure is that you have to notify the ethics board and the reason for it. Again, I'm just merely procedurally. Let's get the county attorney in here and get his take on this.
If you'd like to hear from me, I'm more than happy to speak on the issue.
Yes.
Yes.
Thank you. This issue has actually arisen before, and it was researched before. When a party places on the record that they are abstaining for a vote or recusing, they do not actually have to place on the record the reasons as to why they have abstained or recused. If you recall, this actually arose, if I remember correctly, approximately 18 months ago. But I believe Legislator Haggard might actually recall. But the answer very clearly is that the party does not have to actually place on the record the basis for the recusal.
Thank you, Mr. Chairman.
Well, now, Stephen? Somewhere or other along the way, that's the way that I read something other in the ethics law or something. That if one recuses him or herself, that they must go to the ethics board and give an explanation as to why they recuse themselves. And is that in there or is it not?
Mr. Chair, in the ethics law, I am not aware of a provision that states that.
All right, thank you. Go ahead, Mr. Malley.
I was just going to say that if it pleases the board, I'd be happy to go on record and put in an ethics reason that I recused, but I simply will just say it publicly. I recused because both candidates I thought would do an equally excellent job serving Dank, and so I wasn't going to make a decision between the two of them. That's why I recused, so I'll go on record as saying that, but if you'd like me to file something through ethics, I'd be happy to do that.
Was she asking?
Any further business come before the board?
Move the adjourn.
Seconded by Mr. Fay. All in favor?
Right.
We're adjourned.